Hi everyone, my name is Kelly Poppaw. I teach the Finding Dysfunction class, and I'm here to talk about a little bit about what we do in the class. So the cool thing about Finding Dysfunction, opposed to all the other classes we have in Great Lakes seminars, is that we really cover the assessment portion of what we're doing in the clinic. We do cover and teach techniques, but we really cover why we're doing those techniques and trying to get down to finding the patient's, the root cause of their pain. We cover concepts like the hypo hypercompensation model. We introduce the JMFC framework, such as the joint muscle fascial compensation framework. And that really helps therapists to utilize that to know where to start treating their patient to try to decrease their pain even on day one. Decrease their pain, improve their range of motion, improve their strength, and really try to figure out if we did find the root cause of their pain or not. And we go through a framework to say, if we didn't improve their pain, where do we go next? So I've found that therapists walk away from this class with just a better idea to how to utilize the information that they already know in their heads. And I think that's a really cool thing because you can make a really big impact with patients and get a lot of buy-in even on day one. So that's the Finding Dysfunction class. Other kind of cool exercises that we do in the class too are we cover all the joints in the extremities, so upper extremity and lower extremity, as far as we go through and utilize the cardinal planes. Cardinal planes is something that we learned in school, but we utilize that as an actual framework to look at each joint in the body and say, what cardinal plane does that joint move in? And so we also give a systematic framework of, at the knee joint, which joint at the knee would we treat first? Which joint at the knee would we treat second and third? So we would treat the patellofemoral joint first, then the tibiofemoral joint, then the proximal tibiofibular joint. And if we're utilizing that and we know each cardinal plane that joint moves in, then we can just see more when we're watching squat mechanics or gait mechanics or what have you. So if we know that the knee primarily moves in the sagittal plane, we want to restore that sagittal plane motion. We should expect a little bit of tibial external rotation with gait as well, so we know that there is some transverse plane motion. But again, we go through and say what cardinal planes that knee joint moves in primarily and what should it not move in, so that we can just see more. So that's just an example of one of the exercises that we do, and it's a blast. We have a really good time, and people walk away just with a lot of content to bring back to the clinic on Monday. So thank you.